Hey, everybody. Welcome to Dental Voice with Zyris. My name is Rolando Mia, and today we have a very, very good old friend, not old guy, a good friend who's been a long, enough of that. Everyone, meet Dr. Bryan Laskin. He's been a guest on Dental Voice a bunch of times, and what I love about Dr. Bryan is his mindset. He's always been about technology. He's all been about innovation, and that's what we're going to talk about today. Dr. Bryan Laskin, thank you so much for joining us. It's so good to see you.
Oh, thanks. It's always a pleasure to spend time with you. I've said it before. I don't know of a more positive, just infectiously positive person in dentistry. So I always love spending time with you, Ro.
Well, appreciate that. So everyone, what we're going to talk about and the problem that we're going to address or solve today is this issue of technology and how, what's the deal with technology and in the dental practice, specifically this whole thing about AI. There's so many things coming up around it. There's that type of stuff. We recently had a discussion with Dr. Bryan, and we're going to dive into that. So, Dr. Bryan, AI, what the heck is it, and how does that kind of fit into dentistry, and why should we either love it or not?
Well, great question. And I love the fact that you said, what is it to begin with? Because I think a lot of people now say that they do AI and they may or may not actually be doing like the deeper pieces of AI. So first of all, if you think AI has been with us forever, Google search is an artificial intelligence. But when people are thinking about AI today, what they're really thinking about is machine learning, deep learning, such that machines are doing processes that we don't even know what they're doing to come up with conclusions. So I like to think about it from the perspective of when we're talking about true AI, we don't even know what it's actually doing. It's solving problems that humans can't solve in ways that we can't understand so that we can get effects that we can get procedures, processes, conclusions that a human either it would take way too much effort or way too much time or would be impossible for a human to do. So let me expand on. Oh, go ahead.
So sorry. Does it mean that it eliminates the human piece in this?
No, I like to think of it as augmenting humans, right? Now, so for example, let's say if you wanted to research what causes decay in a deeper way, right? You could go and you can go look at research studies. Now, reading research studies takes humans a lot of time. However, the right AI deep think model could actually read all of those studies, read all across all of the recorded history, combine that with all the medical studies on recorded history, and come to conclusions with I like to say like the ultimate beginner's mind, right? That because computers don't have emotions that they have previous experience with, which is a hugely it's a huge influence in how we humans make decisions, right? So we can come up with novel conclusions that we might not otherwise have seen. And I think for the foreseeable future, we're going to have humans using AI to kind of give us superpowers. Now, there's externalities that can come with that we don't quite know what that's going to be. And that's where the fear comes in, right? But I think this is a technology like other technologies that needs to be it needs to be used mindfully, needs to be possibly regulated, and there's a lot of talk about that. Certainly we don't want it to go unhinged. We want there to be standards and regulations around these processes. However, just like all technology, and there's everything from the an iron that you iron your shirt with, right? You can burn somebody with it, or you can remove the wrinkles, right? So a lot of people say they're either an AI optimist or a pessimist. I like to be a pragmatist. Like let's look at this technology for what it is. If there's anything we can do to help put guardrails on it so it doesn't get used in nefarious or problematic ways, great. But let's agree to what it isn't, right? And that's where we have to start in dentistry. It's not a simple algorithm that says if this, then that, right? And what it's not best at is doing things that humans are good at. Treating patients, number one, from a human perspective, human to human, even simple things like we're doing in dentistry, like reading a radiograph. do we really need AI to do that? No. If we want to replace the dentist, then you can to some degree replace a dentist reading that. But is that the highest best use of AI? I would argue no. I think all we're doing is then it's just taking a tool and applying it in a way that humans can already do. Let's leverage this in ways that to do things that we can't do today.
So I love the context around that. Let's start with what it isn't. And specifically, it's not something that is designed to basically replace what you can already do. Is that what I heard? And
Absolutely.
Then the context around what you mentioned earlier, and this is just this kind of, you're right. You know, a very knowledgeable person can do research, but an AI system can integrate virtually anything that's ever been written about the subject and present it to that person. So now that person can use their intellect, I'm going to call it, or I don't know, human intelligence to expand or to create things. I love the way that looks. How does that, so if it's not being used to help, or when it's being used to augment, how does that apply in dentistry? I mean, from your perspective.
Yeah, I think first of all, we're all learning about the capabilities of this technology as it grows. But ultimately, look, for the foreseeable future, we are going to have a labor shortage in dentistry, right?
Yes.
There's been a lot of people that left the profession, and frankly, we just have a lot to do. So right now in dentistry and for the foreseeable future, I think that there's ways that we can leverage artificial intelligence to take the boring, laborious, mundane, soul-sucking work and take that out and de-burden our team members, right? Make it easier for them to do what they do every day. For example, if you're writing a marketing email, right? Why have your hygienist or your or the person that your receptionist or the person who runs your business office sit there and think about the best marketing email to craft to a bunch of patients, when you can leverage artificial intelligence to help create the first draft, and then you can spend your time editing, right? So what it does is it takes the workload that we're doing today and make it quicker, easier, and then we can humanize the output of the machine, right? Versus having people do boring, laborious stuff that, if you actually sat, for dentists who are watching, and you just sat and watched what people that are at the business office of your practice, what they do every day, the vast majority of what they do has nothing to do with treating people. It's just things that can be automated, right? And that's where I see right now, in this point in time, there's just a huge opportunity to leverage AI.
That is so cool. Does that incorporate? So you mentioned the non-clinical. How does it tie into, or how can it be leveraged for clinical?
Well, that's a great question. I think a lot of the ways we're going to use AI are just kind of like behind the scenes. We don't even think about it. So, for example, I'm part of a startup that's doing AI restoration design, where they can design a denture in like a minute, based on extrapolating a bunch of idealized occlusion with motion tracking and things that a human, like a laboratory technician, would be very difficult to do. So everything from restoration design, evaluating restorations, evaluating treatment plans, creating a first draft treatment plan. I personally believe that every aspect of dentistry is going to be touched by artificial intelligence over the next, let's just throw out a number out there, decade. But in ways that we don't even think about it. Like, we don't think about the artificial intelligence that's behind when you do a Google search, right? But it's happening, right? You're just looking for the end result. And I think we're going to, a lot clinically, particularly, we're just going to take our impression or get help with, there's going to be help or an artificial intelligence sort of assistance to grade your preparation, tell you what you could do to make it better. While, if you're using a 3D scanner, for example, and then that design, that restoration, that communication with the laboratory, all of that will kind of happen much more effortlessly than today. But you won't even think about it as artificial intelligence. You'll just think, this is the new workflow that makes my job easier, makes the end result, the quality better. right? Makes things more consistent. And so that's sort of the positive aspect that I see, that we're going to have this on the back end, this engine running that has much more horsepower than we have today to make everything smoother. Now, again, there's some risks and externalities that we have to talk about, but but looking at from a positive perspective, I think that we're going to have a lot of what we do enhanced in ways that we don't even conceptualize how it's happening. It's just happening on the back end. Like, if you use CAD CAM dentistry today, you might be thinking that process, that workflow is just going to be so much more seamless, better results, better feedback, better materials. All of that is going to be possible through leveraging AI, but the average dentist probably won't even think about it that way.
What strikes me, and it ties back to what you said earlier on about using it to augment what you're already doing, and then utilizing and adding the human aspect, because it can create things so much faster, and then you edit it afterwards, as opposed to thinking that it's going to somehow replace. Because I personally don't think there's a subtlety in the human aspect of everything, and you're never going to replace that. And I love the idea that it's the engine behind. When people are looking at this, it just seems so overwhelming. What advice would you give people to start? Because, I mean, where do you start? There's so much technology out there. It's almost a little overwhelming, because what do I do? What do I do? And then people tend to just push away. How would you tell people watching this to start? Where do they start? Is it start with AI? Is it start with other technologies? What's that all about?
Well, first of all, if you're not into technology, I don't know if AI is the place to start, right? I think that there's the core of everything. I think goes back to right now. If you're looking to implement technology to further your practice, the number one thing I would look at is, how does it make my practice more convenient and provide a better experience for my patients? Full stop. I think that is where to start with technology. Having online simple things like that people don't think about: online bill pay, being able to make an appointment online, in communication between your team members that's secure, things like that are just seem like they're boring. The boring, unsexy things sometimes yield the best results. But if we're talking specifically about AI, I would look at artificial intelligence tools that help give my team superpowers, so that particularly are the business offices of our practices, which are overwhelmed with tasks, give them superpowers to be able to do things like communication with patients, or automate. We don't like talking about marketing workflows, but communications with patients, expanding, insurance billing, things like that. The boring, laborious things that our team members have to do every day. If we want to attract, retain the best people, we should get rid of the tasks that good people don't want to do. Right? I mean, you can sit there and you could push a button for every 10 seconds for 24 hours, but nobody wants to do it. You can have a robot do that too, right? And the same thing is true in your practice. There's so many things that we can automate, that you are forcing good people who want to talk to humans, have human to human contact all day long, and we have them shuffling papers or sitting on hold on a phone call, or those types of tasks that's what I would look to unburden my team with. And then also, I think, go ahead.
No, I love the context around that. You mentioned and as you're speaking, it's not about replacing people. It's about eliminating, I'm going to call, redundant and repetitive tasks in a much more efficient way, freeing up whomever used to have to do that, and giving them the ability to do something a lot less boring, but also helpful for the practice. Right?
Absolutely. Yeah. I mean, let's face it. If everybody in our practice can be more efficient in what they do and spend more time talking and like one-to-one with patients, they're going to have a better experience, right? That's what patients are looking for, right? They don't want us looking at a computer screen. They want us looking in their eyes, the level, right? And there's this thought that AI is going to dehumanize our practices. I think it could do the opposite. Let's take the dehumanized activities and automate them so that we humans can humanize the practice, right?
I love that. Take the dehumanizing activities, pull them away so that we can rehumanize. It's interesting that you mentioned that AI and technology can actually humanize a practice. I love the idea behind it. I also love the idea that use AI to do things that we don't want to.
Yeah, or we can't. There's a lot of things that humans are just really, really bad at. And like you said, repetitive tasks, frankly, we're bad at it. Not like you and I, we as a species, right? Or consuming massive amounts of data and coming to conclusions is just we as a species are really bad at it. Making non-emotional decisions, we're bad at it, right? Let's use AI for those things.
That is huge. What would you suggest, or what would you caution our viewers or people considering this absolutely not to do? Like this is the road to hell if you go down this route. What would those be?
Well, so I like to talk about any technology. I call it the cost of implementation. It's a filter that I use to evaluate any technology, and it's an acronym. C stands for clinical quality. O is observations by patients, or the patient experience. The S is a $ for ROI, and T is team health. Okay, those first two, clinical quality and observations by patients. Anything that has the potential to have a negative effect on reducing your quality or making the patient's experience more negative in your practice, don't even start. I think right there, anything we implement in our practices should either at minimum keep our experience for our patients and our clinical quality at least neutral, but more than likely be positive on both of them. So that's what I would say. Anything that reduces your quality of care or reduces your patient's experiences is a hard no for me.
Oh, I love it. Wait, C, cost, clinical quality. I guess quality doesn't the C, does it?
No.
Quality.
CQ, clinical quality. Yes.
O, and O is for
observations by patients,
which is the experience that they're having. Because if I have a bad experience, I'm not going back to you. That's simple, right? S is the $. I like that because that's easy to remember. And then T is team. So yeah, cost. Actually, it also incorporates, it's going to cost you a bunch of money, and it may or may not be $. It could be time. It could be resource. It could be all that. I love that. Cost.
Absolutely. And you make a good point. The first two are like a light switch. Either it helps or it doesn't. And if it doesn't help, they're out. Both ROI and team health, typically speaking, something's going to take time, energy, or money, or all three, like you're saying, right? Same with team health. Like your team is going to have to learn to do something different. So both of those almost always take some type of a hit. So what we're looking for is two things. How far is the dip? How far down do we have to go? Like how much do we have to invest? And what's the pop? What's the prize on the other side? And is the juice worth the squeeze? Is the investment of time, energy, money, my team's health, is it worth the prize on the other side? And usually we have to factor in, because many times people think like immediate, think long-term. If something saves you 30 seconds for every appointment, if you calculate that off over the course of 3 years, it's enormous amounts of time. So in dentistry, we tend to overestimate the cost, the dip, and we tend to completely underestimate the size of the prize on the other end. So if you could use some AI tools to help calculate the size, the investment and the potential return, or that's where I think that's where some time should be spent. If it increases your clinical quality and it increases your patient's experience, then take a careful look at how much does this cost you in time, energy, and your team's health and your time, and then how much are you going to get in return and when?
I love it. Clinical, observation, $, and team. So we've been talking about AI. Just as for viewers, what are some examples of like AI systems available now that you would have people look at?
Well, I'm going to talk about some ones that are outside of dentistry, right? Because
GPT, that type of thing, right? Some of
yeah,
the Google ones.
absolutely. And if you haven't played around with Chat GPT, it's a very easy place to start because everybody and their mom has probably played around with Chat GPT. You know, there are ways that you can train Chat GPT, but it takes a little bit of time and energy that most dental practices aren't going to want to do, frankly, right?
Right.
Other tools like Jasper is a good one that you can look at. It's jasper.ai, I believe, or copy.ai that can help you with copy editing, writing. There's a lot of tools to help you that will help you edit videos if you do any of that, like creative things for your practice, right? I'm trying to think of ones that I'm not part of that I can message to, but even the ones that are available today, what I would say is that the ones in dentistry, which typically speaking, when people are thinking of AI, they're thinking of the companies that do radiographic reading, and then they might do like a morning huddle, Pearl, Overjet, Vidya, Denti AI. These are all great companies, right? And I think they have value. The question is, and this is what I get concerned about, is that in the year at the end of 2022, coming into 2023, I'll ask you this question, Rolando. Okay. What is the technology at the end of 2022 into 2023? What is the technology you think that most dentists said that they were excited about incorporating into their practice?
CAD/CAM.
The answer was 3D printing.
Yes.
I think 3D printing is great. I have a 3D printer, but it's appropriate for about 0.1% of practices right now. To actually, there's the other 99.9% of practices have probably 12 other technologies that I would recommend implementing before 3D, right? Because, and we could go down the reasons why, but I don't think that's important. I feel like right now at this moment in time, 2020, at the end of 2020, well, not at the end, but we're close to the end of 2023, going into 2024. If you ask dentists what they're looking at incorporating, my guess is they'd be thinking of the AI tools that we discussed. And it's probably not the first piece of technology they should be doing in my mind, right? That's where it's not that these tools don't have tremendous value. I've used them. They're great. I know the people, they all do great things. The question is, if you, like I like to say, if someone asks me like, what's the best electronic car, the best EV car, right? And they're 12, it doesn't matter, right? It's like, what's a bike? What bike should you buy? And in my mind, most dental practices, and I don't say this negatively, we're all busy. There's a spectrum of technology. And for most practices, AI is an electric car when you should get a bicycle. Right. You should focus on what patients care about the most first. What's the patient's experience? What's my team's experience? What are my team and what's my team's experience? What's my patient's experience? What elevates my, those are the things that are going to give you the capacity, the revenue, the new patient flow, that then you can buy every other piece of technology that you want.
That's incredible advice. I love the metaphor about, dude, you're 12. That's nice to know. Go look at it, but what bike do you need? And it's the same thing. Emerging technology seems so sexy, so exciting, but if you're not prepared, don't. Now, talking about all these AI platforms, all that type of stuff, you've been working on one. What is that one all about?
Well, thanks. Yeah. So in large part because what we talked about before, my role, I believe, is to connect dentistry, right? Make our teams function more efficiently and elevate patient care and empower patients. So what we've done is exactly, when I was thinking, like when we've been having conversations about AI, I feel like the gap in AI is being able to empower teams. So what we've done is we've taken a large language model like ChatGPT and we're training it for dentistry. What is true in dentistry? What is not true, right? What if so your team can ask, it's in our product, we have a secure messaging platform called in tooth apps called Forum. So all the communication in your dental practice comes through one secure platform called Forum. Your laboratory, your patients, your team. If you're a DSO, the CEO can message all the hygienists in the organization. It's a really slick tool. But what we've done is we've trained an AI member of your team, somebody who's there, who's for 365, doesn't take a vacation, that if somebody on your team has a question, they can ask Forum AI a question, right? How long does it take? Let's say you have a new person working at your business office, and the patient asks them, how long does my wisdom tooth take to heal? And they don't know, right? They can ask Forum AI, things like that. So what we've done is we're training a large learning model on dentistry so that your team can ask questions, not patients, your team can. And then we can actually train it. If you're like, let's say you're a large organization, we can take your standards, procedures, and train it on that, so that if your employee wants to ask, how long do I get for maternity leave, right? It will answer for you. De-burden the team. So again, just try to make it more efficient for everybody to get communication and have it be specifically for your practice.
That is a cool concept, because now you got to go find places to look at it. You're not quite sure. You're asking other people, and you're stuck in all these other people when you can go to one place. That is so cool. And it's available now?
Yes. It isn't, I have to technically say it's in beta, but yes, it's available now.
That is awesome.
Yeah.
I love every time we have an opportunity to speak, and I always learn all sorts of things when I'm with you. Folks, Dr. Bryan Laskin is the very, very first person who invited me on one of his podcasts. So I hold that very special, because if it weren't for him, I wouldn't be here. So that may be a good or bad thing.
I think it's a great thing. And I should have invited you on earlier, because you're, like I say, I just love talking to you. And obviously I knew what I was doing, because now you have your own podcast and you're crushing it. Congrats to all you do. Look, I've seen the Dental Voice. I'm a big fan of what you do, and what Zyris does. I think that you are just doing, and so naturally positive and inspiring for all of dentistry. So thank you for what you do.
Well, thank you for that. Hey, so we could spend a lot more time. I know that there are a lot of things. I heard too that you also wrote a new book. I'm looking forward to seeing what that. Real quick, what is it called?
It's called Dental Disorder. It comes out on the 7th or on the 19th. So it's,
we're gonna have to check that out. So, hey, folks, if you like this content, well, first of all, if people wanted to reach out to you and ask you questions or just pick your brain around technology, AI, and tools, what would be the best way to do that?
Well, the best way is to go to my personal website, which is my name with no spaces, bryanlaskin.com.
And then if they wanted to send you a message or anything, best way?
Yeah, you can. There's a contact me button right on the website. But that way you can see, because I'm involved in a few different things in dentistry, you can kind of see what I'm involved in, and it's easy to reach out to me there.
That is awesome. Well, first of all, thank you so much for just taking the time and giving us an opportunity, give me an opportunity to pick your brain around it. The concept and the context that you build is always so pragmatic and specific to that. I like that. I'm not a positive, I'm a pragmatist, and you definitely are. I learn a lot from you folks. If you have questions for Dr. Bryan Laskin, please check him out at bryanlaskin.com. If you have questions regarding technologies or anything that he's doing, he is more than happy. And I found him to be incredibly helpful in just taking some time to answer. If you like this podcast, please share it. If you love this podcast, please let us know. We look forward to hearing more from you. And, I can't wait to see you. I think you're going to be at SmileCon, so I'm looking forward to connecting with you there. And you know what? This is excellent. Thank you for joining us. Everyone, thank you for joining, and we look forward to seeing you in the next Dental Voice. Thanks. Appreciate it.
Thank you.